Hi, I'm Scott Green. I'm a plastic surgeon at the Plastic Surgery Center. This is Stacy Lassiter. She's our physician's assistant, and today we're going to talk to you about rhinoplasty. Another word for rhinoplasty that you may have heard of is nose job, trying to fix some problem with your nose that you haven't liked, and it's a pretty common procedure in plastic surgery these days. Rhinoplasty, when somebody comes and sees me for a rhinoplasty consultation, the first thing I do, obviously, as you can imagine, is I look at your nose and I ask you, what is it that brings you in to see us? What about your nose don't you like? That's going to be a question that you hear me ask. And that's because I want to know what things you want to correct. Now, when you come in for a rhinoplasty, it doesn't mean that we can give a person any kind of nose they want. And that's an important thing to understand when you're coming in for a rhinoplasty consultation. There's things that I may be able to correct and things that I won't be able to correct. For example, the rhinoplasty consultation that I just saw this last week, she had told you that there was 3 main things that bothered her. And I looked at her and I said, well, how about 2 out of 3? So sometimes there's things we can't correct. I knew I could correct 2 of the things that were bothering her, but I knew that there was a chance I wouldn't be able to fix the 3rd one. So let's talk about these things. When a patient comes in to see me, you're going to say, hey, this bugs me, this bugs me, this bugs me. For example, most patients will tell me that they have too much tip projection, or that the tip of their nose is too round or too bulbous, or that they don't like the hump on their nose, or that their nose overall is too big or too wide. They may also say that their nose is crooked. That's the one. So there's a couple of things to talk about that I can't fix. And let's just talk about those first so you know what they are and you have some idea about them. One thing that we can't fix in rhinoplasty is crooked. At least I can't promise you I can fix it. We can often fix crooked at the time we're doing the surgery. But there's something that made your nose crooked to start with. And that thing that made it crooked to start with may still be there. And if it's still there, if those tissues, that scar, that tightness that caused your nose to grow in a crooked position is still present, I might not be able to overcome those things long term. Now let's say you're like Marsha Brady from the Brady Bunch. I don't know if any of you are old enough to have seen the episode of Marsha Brady, the Brady Bunch, when the football hits her in the nose, and it was kind of like a TikTok video. It goes back and forth and shows her nose getting hit with the football over and over and over again and bent her nose to the side. And you think, well, there was a trauma that caused this. My nose didn't grow this way. It just happened when the football hit me, or when my brother punched me, or in my daughter's case, when she was tubing on the tube behind a boat and her knee popped up and hit her in the nose. My daughter now has a crooked nose from that. You may say, well, why can't you fix that? That was something that wasn't that way. It didn't grow that way to start. Well, the answer is that I may be able to fix that, but there may also be scar that occurred during that trauma. Even though you can't see that scar, even though that scar might be on the inside rather than on the outside of your skin, you can't see that scar, so you don't know that it's there. It's there, and it might prevent us from being able to keep your nose in the exact right position. The answer is usually I can make the crooked better. Sometimes I can make the crooked go away. It's just not something I can promise you. And I like to have full disclosure with what I know I can promise you and what I'm not sure I can promise you. And crooked is one of those things that I can't for sure promise. Let's talk about the other thing. The other thing that I can't promise is skin thickness. The analogy I like to use when we're talking about skin thickness is that of a down comforter. So let's say you're a patient who comes in to see me for a rhinoplasty and your nose skin is very thick. That means this skin on the tip of your nose, when you squeeze it, you can't pinch it because it's too thick or too fat. That skin's thick or fat or dense, and so it won't fold or pinch. When skin on the nose is thick and we're trying to shrink portions of the nose, especially when we're trying to refine the tip, the work that I do underneath the skin on the cartilages to improve the shape of your nose, it is going to be able to be seen or not seen, or the visibility of what I do may be limited by the thickness of the skin on your nose. And a down comforter is a good way to think about that. If you get in bed and it's cold one night and you have your socks on because it was freezing as you were walking across your floor, and you jump in your bed and you pull your big down comforter up over you and you snuggle up in bed, and then an hour later your feet are getting hot and you pull your socks off, you leave them in the bottom of your bed. If you remember that you left them there, you'll remove them. But if you don't remember you left them there and you pull your down comforter up over the bed, you may never see those socks, even though these big bulky socks are sitting there in the bottom of your bed. Now, if you don't have a down comforter on your bed, but you just have a thin sheet on your bed and you wore your socks to bed anyways, for whatever reason your floor was cold, and you leave those socks in there half an hour later, in the morning you wake up and you pull your sheet up over your bed, are you going to see those socks? Yes. Why? Because it's not a big thick down comforter covering them up. This is analogous to skin. When the skin on our nose is thin, you can see everything I do underneath it to try and give you the exact pretty, refined, feminine or masculine tip that you want on your nose. When you have big, thick skin on your nose, are you gonna be able to see it? Well, maybe better than you can under the down comforter, but maybe not as well as you hope. And that's an important thing for you to know. So thick skin doesn't keep me from shrinking your nose, doesn't keep you from being able to see us shrink it, but it may keep you from being able to see all of the refinement that you might want to see when your nose surgery is through. Let's talk about the things we can do. The most common things people come in to complain about are a bump on the dorsum of their nose. That bump, if you have one and you feel it, is usually right between the junction of your bone, this part of your nose up here, and the cartilage of your nose, which makes up the rest of your nose down here. That junction where those two structures come together often forms a bump in it. That bump may have occurred from trauma, or it may just be something that naturally occurs with your family. That bump can definitely be removed. That's one of the things that makes the biggest difference in a woman's nose who has a bump on it and her nose looking more masculine. Often women come in and complain that their nose looks like their dad's nose, and making their nose look feminine the way they want it to look. So that bump is something that we can definitely remove, and that works very, very well. And that's usually done by literally cutting out a little portion of that cartilage, or taking a small file, very similar to a tiny nail file, fingernail file, and filing down that bump. Both ways can help us remove that. Additionally, once we file down the top of that bump, it creates a little flat spot in your nose, and we typically need to do something to change the sides. So when we've created a flat spot right in the front of your nose across the top, we've got to do something to take those two sides of your nose, the bone and cartilage, and move them together so that the top of your nose, the bridge of your nose, or what technically is called the dorsum of your nose, has a nice round, gentle slope to it again. We can use some filing to achieve that, but we typically need to do something to modify your bones of your nose. Now, the way I like to modify the bones of the nose is through a small little needle poke in the side of your nose, and we can put little tiny holes in the bone of your nose. This way allows us to move your bones of your nose without breaking it, but just tilting them in on themselves. Then we use a splint to hold those in place. That's usually done at the very end of your surgery, right before we put the splint on. Right after we push them together, then we put a little splint on your nose to hold it in position there, and then those bones will heal in that new position and stay there, and that bump will be gone. The other thing that brings people in, or one of the other main things that brings people in, are the tip of their nose. The tip of their nose looking too bulbous, or too wide, or too turned up, or too turned down. There are different cartilages here in this portion of our nose than there are in this portion of our nose. These are called your lower alar cartilages. And those alar cartilages, or there's one on each side, they make up the roundness or the bulbous appearance of our nose, and they also have something to do with the projection of our nose. Both of those cartilages can be modified during a rhinoplasty to suit what kind of refinement you want in your nose. Obviously, everybody's going to be different. Ethnicities are different. Families are different. Patients may come in and ask for their nose to look like somebody else in their family. Pictures can help us in being able to figure this out. Masculine, feminine differences can exist, and so that refinement can all be done during a rhinoplasty. Also, length of nose, projection of nose. When we're refining the length or projection of the nose and shrinking the length of the projection of the nose, we typically have to modify both areas that we just spoke about. Both the tip and the dorsum of the nose need to be modified, typically to change the length or projection of the nose, and that can also be done. Rhinoplasties can be done in two different ways. One, what we call a closed approach, and what we call an open approach. All of these things can be done either through a closed approach or open approach. Some surgeons prefer the closed approach. Some surgeons, like myself, prefer in most cases to do an open approach. An open approach to a rhinoplasty allows me to see everything in the nose as it exists right in front of me during surgery, and so I can modify it and I can ensure that it's modified exactly the way I want it and there's no variation. In a closed approach, you can't see those structures. You're doing it blindly, and therefore you have to rely on what you see through the outer skin. Now, that works in most cases because that's how the patient's going to view it after surgery, is through their skin. But swelling can also affect things, and so sometimes, in some cases, when we're trying to get very delicate refinement, swelling can alter what we see during surgery and prevent us in a closed approach from getting the most perfect outcome we might want, because we might not be able to see some little error that's present that we've created. Because of that, I prefer the open approach. And what's the difference between an open and closed approach? One thing, and that thing is a small incision across the bottom of your nose here. In an open approach, we make an incision inside a nostril, inside your nostril, and across the bottom of your nose right here. In a closed approach, which is sort of a misnomer because it's not completely closed, that would be like punching somebody in the nose and shrinking their nose. That would be a closed approach. But the surgical closed approach means there's no scar on the bottom of your nose. There's only an incision in both of your nostrils, but not across the bottom. That incision across the bottom, in my opinion, is critical in helping you achieve the best result in the tip of your nose. So if we have a lot of tip changes to do, an open approach, I think, is best. If we do not have any tip changes, but we only have a bump, then I think a closed approach in that circumstance can be utilized to help you achieve your optimal outcome. Other things to talk about with rhinoplasty that are important. With rhinoplasty, it's also important to know that there are limitations on how much we can shrink a nose. So while my nose is big, you can see I have quite a nose. Stacy's nose is very small. And so I often use Stacy as a model when we're in consultation together. I will point out to people that I may not be able to make their nose, if they have my nose, quite as small as Stacy's. Why is this? Well, that's because there's things going on inside behind our nose. Our noses are incredible instruments. They do a lot. Not only do they breathe in air, but they also do things like moisten our air, warm our air, which is very, very, very important. If we're in a dry climate and you're breathing through your nose, and we've done something to block our nose's ability to moisten our air, that very warm, dry air may go to the back of your throat and cause you to have problems breathing, problems with your throat, and a need to feel to clear your throat, or even coughing. Same in cold air situations. So there are limitations on what we can do as far as shrinking someone's nose. Another reason there's a limitation on that is breathing itself. Many of us who were blessed with big noses can breathe really well through our nose. It's super easy for me to breathe because I have McDonald's straw-sized nostrils, and I can breathe through that really simply. If I shrink my nose and make it much, much smaller so that my nose openings now are not McDonald's straw size, but let's say, who has a smaller straw? A coffee straw. Coffee straw size, it's going to be harder for me to breathe. I'm going to notice that. And frankly, if I've lived my whole life with this bigger nose, it being super small like that might bug me. And so that's something that I try and warn patients about when they come and see me, and I'll warn you about and talk with you about, depending on what your desires are, as to how much I can shrink it safely. Shrinking the nose also changes the way that air flows through our nose. And sometimes it can create what we call turbulent flow inside of your nose. That turbulent flow can cause collapse of the sides of your nose. So for example, you know those breathe right strips that you can use to help you sleep sometimes at night. It can also help you prevent snoring. Well, those really are there to help collapse of the side of your nose. When you breathe in through your nose fast, if the side walls of your nose are close to the center, they can get sucked in like a vacuum. Those breathe right strips help with that. Well, when we shrink a nose, we're putting those side walls, these two side walls of the nose, closer to the center. And so that might change the way it feels to breathe, like you're breathing through a coffee straw. And it might also cause your nose to collapse easier. Now, collapse is not something that we expect. That's a nose surgery complication. And so if you have collapse after a nose surgery, that may be something that brings us back to surgery to fix if that occurs. If you have problems breathing ahead of time, which is something also that brings people in to see us for a rhinoplasty consultation, they may have trouble breathing through one side or the other. They may have what's called a deviated septum, a bow in the structure or a bend in the structure that divides our left and right sides of our nose from side to side. That bow in that septum may make the side wall of your nose close to the middle, creating a narrow enough passage that that side of your nose collapses when you breathe fast. And so there's things that we do during surgery to try and prevent that kind of collapse. We do things like spreader grafts or modifications to your septum or modifications to the side wall to help improve your breathing overall. There are other things we can do to improve breathing, to things like your turbinates. Now, those are the structures I was speaking of earlier that warm and moisten your air. The turbinates are little bumps inside of our nose. They're over here on the inside of these bones, and they're little outpocketings or outcroppings of tissue, bony tissue, that has mucosal tissue or inside nose lining tissue around them. When you have a cold, those are the structures, and that's the tissue that gets swollen, that makes your breathing not as good anymore, that you may use some breathing aid like a nasal spray or a nasal decongestant. Those are the things that cause that nasal congestion. When somebody has a permanent problem in those areas, we do things to modify those structures to help one breathe, to be able to alleviate those obstructions that they have, that they came in with, that they were complaining about. Other risks of problems with nose surgery would be things like maybe being able to see that scar in your lower nose, or having the crooked come back after we fixed it, or even having a small wound or small problem with the tip of your nose with its healing. Another portion of our nose surgery may involve what we call weir excisions. Weir excisions are when a patient comes in and they say, my nose is very wide and I want to narrow the base of my nose so that it's more refined. In that case, we do things that are called weir excisions. And these actually shrink our nostril from a larger size to a narrower size. And that involves a little scar or incision along the side of the nose. That sometimes can be used not only to shape a nostril better, but to help it be in more balance with the more refined tip of our nose that we have. In the case that we have thick skin, back to that thick skin again, in the case that a person has thickened skin, that weir excision may not help somebody as much, because that thickened skin also often covers the side of somebody's nostril as well. And so when I see you for examination, I'll be able to tell you exactly what I think and exactly what outcome I think you'll be able to have from each of these different types of procedures involving the rhinoplasty. At the end of the surgery, it takes about 2 hours to do the surgery, and at the end of the surgery, I place a splint on your nose. You go home with that splint on. You wear that splint for 8 to 10 days. You come back to see us on day 4 after surgery. We remove that splint. We look at your nose, and there will be some tape on your nose also. And we'll examine your nose, and then either I or Stacy will put that splint back in place on you, and you'll wear that for another 4 to 5 days. Come see us on day 10. We remove everything. And again, also during day 4 or 5, your first post-operative visit, you'll have the stitches removed if you have them underneath your nose on that small incision. You come back and see us for that time. We do both of those things. And then after that 10-day period, we take the splint off. By then, usually you'll be able to see an awful lot of your results. They'll look pretty good by then. You can probably go back to work by then. Most patients' bruising that they might have underneath their eyes should be gone. Not all of your swelling will be gone, but most of it will be gone, such that 99% of patients at that point, their nose looks just the way it's going to look, except for a little bit of swelling, and they're very happy with it because it's much smaller than the original nose they came in with. But remember, it will continue to refine itself and improve even up to a year after surgery. So the final exact result won't be present until you're 10 months or 12 months after surgery, but you should expect it to look really good and you'll be comfortable with it and happy with it. After that 10-day visit, you come back to see us post-op. That's rhinoplasty. Can you think of anything else?
I think you covered it all.
Okay. That was long-winded. I hope that was informative and you got a lot out of that. There's a lot involved in rhinoplasty. So when you see us for consultation, we'll talk about your specifics.